Hello, I'm John Holds and welcome to the practice. I'd like to discuss the topic of blepharoplasty. This is a procedure often referred to as an eyelid lift or a lid tuck and is a very common procedure in our practice that patients will undergo. I'm going to first discuss upper blepharoplasty surgery or an upper eyelid surgery. In some patients, the eyelid skin can hang over the pupil to such a degree that this is actually a medically necessary procedure and can be performed on a basis where it's covered by insurance. We see other patients who have either less severe skin or hanging over or prolapsing fat, in which this is a purely cosmetic procedure. And I actually see a fair number of patients in whom the eyelid skin hangs over to a degree that it would be covered on a medically necessary basis, but they have other issues such as prolapsing fat that needs to be taken care of on a purely cosmetic basis. Additionally, most patients who undergo upper blepharoplasty surgery have some degree of eyebrow ptosis. This is a common aging change and contributes to the overhanging skin in the upper eyelid, and I'll deal with that topic in a separate clip. The patient presenting for upper blepharoplasty, we have to first perform a medical eye exam and determine that you're a suitable candidate for the procedure medically. You don't have such severe dry eyes or such that you're at too high a risk to undergo this procedure, and also determine that this is the appropriate procedure for you to undergo. The upper blepharoplasty procedures, if medically indicated, we have to get some additional documentation, including photographs and visual fields that would be required by insurance. The procedure would typically be performed as an outpatient under a local or sedated local type anesthetic. It takes, once underway, approximately an hour to do, so you may be tied up for 2 to 3 hours in the process of getting this done. The surgery can be performed in a hospital, outpatient surgery center, or many of the cosmetic patients will wish to undergo this as an office procedure to avoid additional charges from the operating room and anesthesia. The procedure basically entails marking the appropriate area for surgery, injecting initially some dilute local anesthetic, which will provoke very little side effect and stings very little, so it's almost painless. We'll cleanse your face with a prep solution, establish a sterile field in a routine fashion for surgery, and remove some combination of skin, muscle, and fat from the upper eyelid. Typically, the sutures placed are removed about 1 week postoperatively. You can expect with this sort of surgery to have enough swelling that you shouldn't drive or really be out for probably 1 to 2 days after surgery. Usually within a day or two you can put on dark glasses, but I tell folks not to tell anyone who operated on them. Basically, you can expect to be moderately swollen and a little bit bruised, usually for at least 7 to 10 days. Women who wear makeup, I usually don't want you to apply makeup to the upper eyelid for about 11 to 14 days postoperatively. In terms of how long it takes to recover, I often use the family wedding standard in that you wouldn't want to be in photos for a family wedding, possibly for 6 to 8 weeks. So it's not a procedure that you want to have done immediately before a major social event, but in terms of function recovery to get back to work, often less than a week, and to look ideal in social situations, certainly less than 2 months. Now, I'm going to also explain separately lower eyelid surgery. Patients can also undergo, on a cosmetic basis, a lower eyelid surgery. This is almost never covered on a medically necessary basis by insurance. In lower eyelid surgery, part of what we're trying to accomplish is remove the fullness or fatty, quote, bag, end quote, from the lower eyelid. Although part of what we're doing is really addressing aging changes in the middle face that happen as you mature. And part of that change is loss of fat and increased prominence of the so-called tear trough, this line that frames the lower eyelid and defines the lid at a lower level, almost cutting a groove into your cheek. The goal typically of a lower lid surgery is actually to redistribute fat. Years ago, surgeons tended to purely remove skin, muscle, and fat from the lower eyelid. Now we usually look at this as an effort to relocate and rebalance the fat in the lower lid, move fat from the eyelid into the cheek, and smooth the transition between the eyelid and cheek. Typically also in the lower eyelid, we have to perform some sort of procedure with the skin, ranging from either excising a very tiny strip of skin in the lower lid to take some fullness and apparent excess tissue away, to performing a chemical peel or laser skin resurfacing of the lower eyelid. Additionally, if you wish to discuss lower lid cosmetic surgery, we probably will discuss other possible adjuncts such as facial fat transfer. It's possible to correct some of the aging changes in the face, to actually use some of your own fat from a site such as your abdomen or hip, and transplant that fat into the face to fill out areas that tend to atrophy and sag as you age. I hope this video helps to give you a better understanding of blepharoplasty surgery, and I look forward to examining you and answering any questions to help you make your decisions regarding this. Thank you.